Well, it's great to be here, and I'm going to take you through our work across health and innovation, and also our vision, really, for the future of health. And it's a vision that needs to make sense for all of you. You're here, it's Sunday afternoon, but you're dedicated to seek new knowledge, to be curious about the future, to have new creative challenges. And our vision for the future of health is very much one in which all of you will thrive. But it's also a vision for the future of health that needs to make sense for people who are more socially and economically excluded. And so this is a story about the future of health that takes both of those things into account. So we are Nesta, the UK's leading innovation charity. We bring great ideas to life through our investments and our grants, but also through our research, our skills, and our networks. And we cross-pollinate between different sectors. And I'm going to give you just a brief overview, really, of the work that we're doing across health. So what's our take on the future of health? Well, it's a future that is informed by three of the big major trends that's affecting our health system at the moment. The first one is the big redesign challenge of the 21st century. And that is, how do you take a health system that was designed for the 20th century challenges of acute and infectious disease and redesign that system for the 21st century challenges of long-term conditions? Because the reality is, the success of us dealing with acute disease means that many more of us are now living many, many years with multiple and complex long-term conditions. So that's the big redesign challenge for our health system. That's the first driver for our piece of work. The second driver is technology. Now, as you would imagine from an organization like Nesta, we see technology as being absolutely central to the future of health in terms of it being embedded and integrated into our experience of health, both in terms of what are the technologies at the fingertips of clinicians, but also in terms of the technologies that we as patients all use in our day-to-day lives. So that's the second big driver. And the third is really a recognition that actually the future of health is more than just re-engineering processes and getting the tech in place. Actually, the future of health also needs to create the conditions for empathy, because there is a social dimension to health and a social dimension to innovation. So that's the third big driver for our work across health. And so our work across health takes lots of different forms, actually. So I'll give you some examples. We have had People-Powered Health has been our major practical innovation program, where we have been working with 6 different clinical teams across the country, supporting them to redesign their health services for the future. Dr. No is an example of some research that we've been doing on the future of data and knowledge for health. 5 hours a day has been a think piece that we've come out with recently, really making the case for the aging population being a major innovation imperative for all of us, and one that's going to have major health implications. And 5 hours a day, interestingly, is the rate at which all of our lifespans are increasing per day, which is kind of mind-boggling. We've also got an impact investment fund, which is open for business, looking for social investment opportunities across the aging space, and an Aging Well Challenge Prize, and so forth. So you can get the sense that we work in lots and lots of different ways. And what I'm going to do for you now is pull out some of the key insights from across that portfolio. So I'll start with our overall vision for the future of health, and it's one in which we think we need a rebalancing of our health system. So understandably, actually, our current health system is overwhelmingly focused on the model of doctor cures patients. Now, obviously, that remains incredibly important, but we need to get better at other modes of the health system. So the second aspect is getting better at health by people. And by that we mean giving us all the skills and the confidence and the knowledge actually to manage our own health and our own lifestyles in all of the many thousands of hours a year that actually we're nowhere near a clinician. So this is about autonomy and independence and empowering us as patients. And then the third aspect is health with people. And by that we mean creating and sustaining social networks for health. And I'll say a bit more about that in a moment. And our position really is that in order to achieve this vision for health, we need to begin to understand the health system through different lenses. And I'm going to take you through 3 different lenses that we think are useful. So the first lens to understand the health system is really understanding health as a series of networks, clinician to patient, but also patient and carers and families, and it's the latter that I'm going to focus on now. Because we think there is huge potential to systematically connect patients to one another, to enable them to give one another the emotional and the practical support that we all need to live well with ongoing health conditions. And actually, we all know how powerful it is to be listened to and supported by somebody who has experienced the same thing that we're going through. And so these peer support networks actually already happening in lots of different places. The issue really is that they are often ad hoc, quite small, and people often have to stumble into them. They're not systematically referred to them. Interestingly, examples like Weight Watchers and Alcoholics Anonymous are interesting examples of social networks for health, been around a long, long time, and we see these sorts of social networks for health as being absolutely central to the future of health. So that's the first lens. The second lens with which we use to understand the health system is health as a set of relationships. Now, actually, the health system is as much a social institution as it is anything else. It has its own hierarchies, its own behaviors and norms, and we all have grown used to those as we've all grown up within this particular health system. At the core of all of that is the relationship between the doctor and the patient. And if you like, that relationship is enacted during the consultation. And we've all grown used to a particular form of consultation, so it tends to take about 10 minutes. You come in, you sit down, the doctor asks you what the matter is, you talk about symptoms for a few minutes, they check your notes, and then you get prescribed something or some tests. Now, that format has grown up to deal with acute and infectious disease, and it works for that. So if I've got a mild chest infection and I need a course of antibiotics, actually that's fine. But that format is fundamentally unfit for purpose when doctors are talking to patients with multiple and complex long-term conditions that require ongoing symptom management and actually behavior change as well. So we're interested in creating the consultations of the future. Now, some of that is about different time horizons, so actually you might need 45 minutes or an hour to really get to the heart of the matter. But it's also about changing the script that governs that interaction. So we're interested in actually a more collaborative script, recognizing that actually patients have a lot to contribute to the clinical conversation in terms of insights into their own condition, priorities, lifestyle preferences, and so forth. And that needs to be recognized and embedded into how that relationship is transacted within the consultation. So a lot of our work is on the consultation of the future. And then the third lens with which we understand health is health as a set of knowledge. And this is really recognizing that the ways in which we access and share and create knowledge is changing rapidly. We now have a much, much greater capacity to both create and to navigate health knowledge. And in the context of health, this is things like much cheaper biometric sensors, but also smartphones. Some of you might already be using your smartphone to track some of your health and well-being metrics, or sleep with it under your pillow for sleep patterns. All of that kind of stuff, plus the semantic web, big data, it's all pointing in the direction of masses more health data that we need to turn into meaningful health knowledge. And there's at least two big opportunities from this. The first is enabling all of those consultations actually to be based on real-time data, so that actually a doctor might say to you, can you wear this sensor for a week, and the database from that will be used to work out what to do next. The second big opportunity is that actually the 3 million consultations that go on across the NHS every day are actually a massively underexploited resource in terms of learning what works. So actually you can think of them as being small-scale experiments from which we need to extract much more knowledge. So the prize from orchestrating health knowledge much more effectively is potentially huge. So that's a quick whiz through what we think is important when it comes to the future of health. In terms of what's important in our upcoming work, we're really interested in tech platforms for health, both in terms of that connecting and brokerage role, but also in that patient-generated data agenda that we think is really exciting. We think there's much more work to be done on new forms of consultation, so actually group consultations are quite interesting, one clinician, lots of patients. And then things in terms of sort of social networks for health, getting a much more nuanced understanding of what kinds of social networks work for whom, under what circumstances. So that's what we're interested in. If you're active in this space and you want to get in touch, please do drop us a line. We'd love to hear from you, and enjoy the rest of your afternoon. Thank you.